Hello everyone, myself Shiny, lecturer, Diploma College of Nursing. In this video, we'll be discussing about bipolar affective disorder. Bipolar affective disorder is one of the mood disorder. Mood disorder characterized by a disturbance of mood accompanied by a full or partial manic or depressive syndrome, which is not due to any physical or mental disorder. This is the definition of bipolar affective disorder. This is characterized by recurrent episodes of mania and depression in the same patient at different times. Typically, the patient experiences extreme highs, that is mania or hypomania, alternating with extreme lows, that is depression. Intervals between the highs and lows are periods of normal mood. Onset usually occurs between ages 20 and 35. Symptoms sometimes appear in the late childhood or early adolescence. This is the classification of bipolar affective disorder. F31.0, bipolar affective disorder, current episode of hypomania. F31.1, bipolar affective disorder, current episode of mania without psychotic symptoms. F31.2, bipolar affective disorder, current episode of mania with psychotic symptoms. And F31.3, bipolar affective disorder, current episode of mild or moderate depression. F31.4, bipolar affective disorder, current episode of severe depression without psychotic symptoms. F31.5, bipolar affective disorder, current episode of severe depression with psychotic symptoms. F31.6, bipolar affective disorder, current episode mixed mania and depression. And incidence, every 1,000 population, 3 to 4 people get affected from bipolar affective disorder, and ratio is 3:2. And bipolar affective disorder, otherwise known as manic depressive psychosis. The previous is it is known as manic depressive psychosis. This bipolar affective disorder observed more in high social classes, unmarried, widowhood, and professionals. Age 20 to 35 years for mania. So mania more common in identical twins. Depression is more common in women than in men. These are the types: mania, severe mania, and hypomania, and depression, mild depression, moderate depression, and severe depression. The severe mania, otherwise known as delirious mania. So this severe mania is very serious and often needs to be treated in hospitals. And hypomania, it is a less severe form of mania, and both are commonly part of bipolar disorder. And the mild depression, so it involves more than just feeling blue temporarily. Mild depression may cause irritability or anger. And then the moderate depression, so depressed mood along with the presence of somatic symptoms was an indicator of moderate depression. People with moderate depression are more likely to experience primary symptoms of low mood, sleep difficulties, and weight or appetite changes, increased or decreased psychomotor activity. Then severe depression. Signs of severe depression can include feelings of hopelessness, helplessness, worthlessness, and increased irritability, loss of pleasure, trouble in concentrating, and trouble in sleeping, or thoughts of death, especially severe depression. People have this suicidal ideation. And etiological factors, precise causes unknown, and genetic, biochemical, and psychological factors may play a role. Here, the monocytic things have a higher rate of incidence than normal siblings and other close relatives. First degree of relative have 5 to 10% of chance of having bipolar affective disorder. And stressful events and antidepressants use and sleep deprivation and hypothyroidism, these are the etiological factors. And signs and symptoms. In manic phase, grandiose or hyper irritable mood. So which means grandiosity, delusion of grandiose, increased psychomotor activity such as agitation and excessive social extroversion. where people will go and talk people. So patient will go and talk people voluntarily, and rapid speech with the frequent topic changes, flight of ideas we can observe, decreased need for sleep and food. That's the reason we are giving finger foods to the patients. The reason people will not sit one place and they will not have food. They will roam here and there. They will walk around. So impaired judgment will be there. In depressive patient phase, low self-esteem will be there, feelings of hopelessness and apathy, lack of emotional feeling will be there, and difficulty concentrating or thinking clearly, and psychomotor retardation will be there, anhedonia, that is inability to feel pleasure in any activity, and suicidal ideation, especially for severe depression patient. And treatment, so lithium valproic acid, carbamazepine, antidepressants, antipsychotics. These are the common treatment drug or choice of bipolar affective disorder. Then nursing intervention. Administer and record of the drugs as per doctor's order, and we need to monitor actions if any side effects of the drugs, and we need to advise the patient not to take any medication of his own, and monitoring and recording of vital signs is essential. Especially we need to monitor blood pressure and ask the client to take sips of water and apply glycerin and or Vaseline on lips to prevent dryness of lips, so due to medication side effects, dryness of lips. We need to advise them to take glycerin or Vaseline, and advise to high fiber diet and more fruits. So these are the nursing interventions we need to do. So hope you got little idea about bipolar affective disorder. Thank you.